Good evening, everyone. My name is Jewel Jones. I am the chair of the Human Services Committee meeting. Today is January 12th. It's 6 o'clock approximately. Welcome, everyone. There's some things I guess I have to say, but after I say these, I'm going to kind of just talk to the committee members, but I can't. So, just want to discuss the ground rules. No one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participant icon and you will find the raise hand function there. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic to the discussion. Members of the public, if you have a question or comments about the subjects on the agenda, please raise your hand and wait to be recognized. So the meeting is being called to order. Again, Julie Jones, it is 6 o'clock. Human Services Committee meeting, January 12th, 2026 at 6 p.m. Is that you next for the roll call?
Yes.
Thank you, Monique.
Marcel Bondino. Leslie Colon. Present. Honor Luigi. Present. Chancellor Gregg.
Present.
Jill Jones.
Present.
Jennifer Meyer. Tanya Phelps. Valerie Ponte.
Present.
Janelle Satija. And Robin Straker.
Present.
You have a quorum.
Thank you so much. And just so we can be clear, who said, let's see that one there or not, Janelle did inform me that she did not appear.
Okay, so you're marking her as, it's your call.
She is, well, if we're going by what absent means, then she's, and there's no excuse, then she's absent. But she did let me know. I appreciate that. Yeah, and in the future, please just let me know. So just for quorum purposes, but you may still be marked as absent, just to, so I do appreciate that. So we have, okay, so adoption of the agenda. We all have in front of us. Please, if there are any questions, let me know. The plan was to not have, and I sent, I guess, everybody an email. I kind of like, I like to do things in advance so you're not surprised. So the plan was to kind of just talk about some committee things, goals, things of that nature, and not to have informational presentations. I want informational presentations. We need to hear from our agencies and stakeholders and community stakeholders. But for this one, I thought we should just kind of do this, kind of let's go over some goals. And then also, what's very important is the statement of district needs. Now, I know that Julie, how do you pronounce her name?
Janelle.
She sits on the district needs and budget committee. And I would like to hear from her at our meetings. When she hears things there, she brings it back to the committee. So just so you'll know. So that's why there's not a lot on the agenda. And I do want to say that under announcements, while we did not have anything, we do have something because of the strike. And we hope to have Brad Beckstrom from Mount Sinai. And he said possibly around 6:30 with someone else, with possibly a clinician, to kind of give us an update. So that's the only addition that you may see to the agenda. But any questions or concerns about the agenda? Okay, so motion to adopt the agenda.
Motion to adopt the agenda of today's meeting.
Okay. Second. Second. All in favor?
Aye.
Appreciate that. So that was Leslie and then Rob. Actually, Rob and I go way back. All right, thank you. Approval of committee minutes. So, just so you know, an email went out indicating that vice chairs of committees will do minutes. That went out. And sadly, it went out not in a timely manner and there were some issues with the email because Jennifer received it kind of like short notice, but she did do the minutes. And I believe they were sent to you all.
Yes.
And though I was not here, I'm relying on you all. Any comments, suggestions, issues with the minutes? Great. So if not, we need approval of the minutes of December 8th, 2025.
I motion it.
I second.
Chance for motions to accept, and Robin seconds. All in favor?
Aye.
I'm sorry, I should have said, any abstentions before, any abstentions? Any against? All right, that passes, thank you, everybody. I guess next on our agenda is announcements. So, any announcements, anyone? Okay. Right. So, okay. I guess as an announcement, I do want to make mention of, I guess I should give you announcements. There's a legislative, on the 16th, there is an East Harlem Legislative Town Hall. On the 16th, I will be attending that virtually. So it's East Harlem Community Health Committee, Human Services Consortium of East Harlem, and Senator Cordell Clare. This is taking place at Silverman on Friday from 8:30 to 11 a.m. I think you could still register. I have, again, it's in person or virtual. I will be attending.
I'm attending too.
I was gonna say, you know, anything you want to say about it? You attended in the past?
I haven't, but I believe that council member Encarnacion will also be there.
Oh, I think yes. Oh, okay, so sorry. So there's some confirmed elected officials attending.
Yeah.
Senator Cordell Clare, our council member, it says elected, I think she's sworn in. Elsie Encarnacion.
Encarnación. Encarnación.
Get it out first. Encarnacion.
Elsie.
Council member Yusef Salam and Assembly member Jordan Wright. Thank you, Robin.
Yeah.
These are the confirmed attendees. I'm sure there might be others as well. Thank you. And so I didn't make a good copy of it, so I'll make a better copy and I'll send it out. Yes.
I do have an announcement. I just thought about it. The 2026 Hope Night is happening on January 27th. That's essentially when they do the houseless count of people in the streets overnight. So just let you guys know, they're still looking for volunteers for people to come and do a count of the homeless population, houseless population.
And is there, how does one participate?
So they can just go to Hope NYC. Just Google Hope or Bing or whatever search platform you use, and just Hope NYC, and it should pop up, or NYC Hope 2026. So that's happening on January 27th. So I'm not participating in it because I have work priorities, but there's anybody that wants to know, or if they see people out in the streets counting, that's what's going on. So hopefully we can get a very accurate count, especially we have a big houseless population here.
And just. And just so a little bit more about that, and this has been done for like, over years and years and years, right? So the whole purpose is to get a good count, and then what? And that's put on the spot.
I don't know. I guess just to really get that number in there, just to see how many unsheltered homeless is in New York City, because I guess the number that talks about the homeless population or houseless population doesn't count for people that reside in the shelter, but it doesn't count for the exact people that are actually like houseless, that are living on the streets or in the subways. And because, East Harlem does have a significant population, we want to make sure that count is as accurate as possible, because, that's services that we could be providing to our residents, because they are our residents still. So.
Thank you. And the folks that just walked in, who are you? Okay,
Tanya Phelps.
okay, great. Good to see you.
I'm Jen.
Oh, yeah, okay, I'm sorry. So actually, I think they're over there, because that's the, So, yeah, we're up to announcements, so please take that agenda, if you have any questions, if there was something there that you want further clarification about, feel free to ask, and we're moving on. So in terms of, anyway, so I just wanna say this, yeah, I sent out the email to you all, just to give you a sense as to who I am. I am not new to the board, I'm not new to the Human Services Committee, I'm not new as a chair. I was on the board years ago, I think I took the exact dates, it may be hard to believe, I was actually 12 when I was on the board. It seems like so long ago, right? And, so yeah, I was on the board way back when, for quite some time, and people do, they're on the board, they leave, come back, because I still live in the community, so, obviously I'm still involved in what goes on in and around East Harlem. So I'm back again, and you saw a little bit about myself, outside of being a community board member. I was very heavily involved with the Community Advisory Board at Metropolitan Hospital. Robin,
Yes, ma'am.
also,
Yes, Chair.
also, when I was on the board and maybe when I was chair at one point, Robin was on, so Robin and I go way,
It
way
was
back.
fun.
Yes, it was fun, yes. Anything you want to add or say about the CAB?
I felt like we really had a voice. That's about all I could say about it. It was nice while I was there with you.
I appreciate that.
Welcome.
And what I would actually going to want to add to our agenda is, and Robin knows this, reports from our CABs. That would be, and so, just so you know, everybody, on the Metropolitan CAB, there's representation from, the community board, okay? That's a standard, and on the Metropolitan CAB when I was on the CAB as a member of Community Board 11, but also Carlos Diaz. Now, there are two people that were CB11 members on the CAB, one of whom was the representative, which means that person was supposed to then take the information from the CAB and bring it to CB11. And per all policies, procedures, they would also serve on the Human Services Committee. Now, that means that you would hear from Metropolitan Hospital, as you're the representative on the CAB, you come here and you tell us what the CAB said, and vice versa. There is someone from Harlem Hospital that's supposed to be designated to serve on this committee. There is someone from Henry J. Carter that's supposed to be serving on this committee. So just so you know, say it when you haven't seen it.
Never.
Okay, so just so you know, and there is a representative from Mount Sinai as well. I can't speak for that person, I have to verify it. If there's someone here from CB11 that serves on that CAB, and maybe I'll ask Brad when he comes and see who the person is, or if the board knows. So the intention is to hear from our health and hospitals and our CABs, and our health and hospitals and the CABs. So, just so you know, there are opportunities if you'd like to serve on a CAB. If you live near Harlem Hospital, Henry J. Carter, reach out to the CAB. Say you'd like to join. Say you'd like to be the CB11 rep. And that'll be great, because then we'll hear from Henry J. Carter and Harlem Hospital, along with Metropolitan Hospital. Any questions or concerns?
CAB stands for Community Association Board.
Community Advisory Board,
Community Advisory.
sorry about that, so it's the Community Advisory Board.
My sister would, I think my late sister, she
Oh,
did
sorry.
Harlem Hospital.
Okay, that's sorry.
Mhm.
We haven't had anybody representing here, Metropolitan, in a very long time.
And so that's important, so just so you know, the actual bylaws say, or it's now called the MOU, Memorandum of Understanding of the Health and Hospitals. It does say that first they serve on the Human Services Committee, and then they can serve on another committee of the board, not necessarily Health and Human Services, or Human Services, as this committee is called. But there should be that representation here, just so you know, and I like to have that representation. Any questions or concerns? So in addition to that, again, I would like to make sure that we have our informational presentations from our agencies, Department of Health and Mental Hygiene, where I worked many years ago. Health and Hospitals, as I just said. Department of Aging. Have you had representation from the Department of Aging?
Once.
Okay, so there are things in place to reach out and say, please come back, please provide information, et cetera, et cetera. I just named a couple, but all those entities that are listed under informational presentations, we should make sure that we're hearing from those entities. As well as community stakeholders. Marika, am I saying that correctly? Marika. What she is. And other stakeholders in and around the community. And I've reached out to a couple here and there.
Intersection where that driverless horse-drawn carriage finally came to a crashing halt. Luckily, there.
Thank you. The COAD, for example,
They've been very active, they have been very active in joining.
oh, good, because I actually, and I have, I know Carol, I know Angel, for example, so they have, and I reached out to them. I'm just mentioning a couple, so I'm looking at you because of, you know, what you do for a living, and perhaps would like to hear from entities within East Harlem here at the Human Services Committee.
Well, one of the things that I would like to bring to the table, and I brought it to Public Safety and Transportation, was to get the EMS chief that covers the northern part of Manhattan to see what is the statistics in terms of mental health care, response time, availability, because Lenoxville Hospital has removed 3 ambulance services from their stream of responses, causing the east side units to now go to the west side to take care of any 911 call, and the response time has elevated.
Yeah.
So now, what does that leave East Harlem with? What does that leave the people in this community that have asthma, heart attack, high blood pressure, diabetes? When you call 911, and it's not a cab service, when you call 911, it's because they cannot physically go downstairs and get a cab.
Right.
They cannot get adequate transport to the nearest 911 hospital. So I was asking to see if the chief of EMS, not Lillian Bonsignor, because I know her personally, she's a commissioner, but the chief that covers the northern part of Manhattan, to see what can be done.
What did you say earlier about Lenoxville Hospital removing?
Lenoxville Hospital had ambulances in the 911 system. They
Okay,
removed 3 ambulances out of the 911 system.
got it.
Okay, they're EMS, they're EMTs and paramedics, but they're not FDNY EMS. So they removed those units out of the stream, and now EMS has to overcompensate, or they have to provide overtime to cover those units. But now you're taking blood out of a stone, help making these people work triple overtime to cover something that should have stayed in place. I don't know why Lenoxville did it. I don't know what was the
Well,
budget.
the hospital has a multi-million-dollar expansion.
I can't say, but I'm just worried about my community being
Understand.
neglected, because now all the units on the east side are being pulled to the west side, or put up north, or pull down south. So now this community is being neglected, basically. So I wanted to see if that chief can come and give a report to what's going on and what can be done
Great.
for this community. Because, I mean, yeah, there's an AMS station at Metropolitan right behind Draper Hall,
Mm-hmm.
but how many units come out of there? How much overtime are you gonna, make these people do to cover this area? And then if they don't see a unit being utilized enough, they'll take it offline. Yes, they've done that.
So we need a name.
I do have a
Okay,
name.
so provide us the name, and we will look into that. I will look into that. Okay.
Jill, you have a hand raised,
Yes.
from the Dreamer Northville.
Say yes, yes. Please,
She's
Hi,
with
can
us.
can you hear me?
yes, we can, thank you.
My headphone keeps connecting, I promise. Hold on, let me just get this squared away because I want to answer you properly.
And please, when you speak, say your name and where you're from, appreciate that, and contact the.
Can you hear me?
Yes.
Sorry, okay, my apologies. So my name is LaDreamer. I serve on Community Board 10, and I also work for Northwell Health Lenox Hill Hospital. I don't have anything to do with the ambulances, but I will bring this back to their attention and see if we can have someone come out and speak to you all, if that's okay.
That's perfect. Thank you very much.
Yes.
I think that. What I will do is I will send you an email, if you can provide your email and contact information, so I can send to the board office, but feel free to send it to me directly if you'd like. But we can follow up.
Yes, I'll drop it in the chat right now, okay?
Thank you so much. I appreciate that. Thank you very much.
Of course.
That's very nice. So before I go, so was there any, so that was, we were just talking about, anyone else need to say something? I was, as I was speaking, I was gonna say a little bit more about myself in terms of the email that I sent out. So I think I stopped at the CAD part, but I'm also heavily involved. We Act for Environmental Justice. Chancellor was at the meeting for the general meeting. That's every second Saturday, but that sometimes fluctuates because it's actually this Saturday coming up. We Act for Environmental Justice. That's a big passion of mine. And environmental justice is something that I think every committee should be involved with, and most especially human services. We should be concerned about our environment here in and around East Harlem, making sure that the air is fresh. It's not getting be fresh, but
As much as it can be.
Damage.
Exactly. But we should be mindful of that, and we'll know that East Harlem, and there's, in terms of pediatric emergencies, that we have a high percentage of that, and just respiratory issues in general. And we can ask, why is that, everybody? Because, with the trucks and then off the FDR Drive and the lack of trees in and around East Harlem, and I'm not gonna go on, because that's a whole separate discussion. And I'm also involved with other things in and around the community. I do work for CUNY. I work at Gutman Community College. I am the Chief Diversity Officer, Title IX Coordinator, and that's my field. I've been doing that for dozens and dozens of years. Working in most people say EEO, but it's investigating complaints of discrimination and harassment. That is my field. I've been doing that for quite some time. Other than that, I think those are the basic things. And as I said, I was on the board many years ago, back, and ready to move on. Are there any questions or concerns anyone have that we need to discuss before I go forward with the agenda? Feel free. All right. Well, okay. Well, then we're gonna move on with the agenda. As I said, do expect that we may have to pivot because I'm gonna hear from outside now. But let's move on. So I thought that would be great if we kind of talk about, review perhaps committee goals for 2026 and the strategy for accomplishing these goals. And the other main thing to be discussed is our statement of district needs. And I thank you, Marlene, for setting that out. I read this in my spare time. It is a lot. So what I've done was, not all of this pertains to human services. And a lot of what's in here does pertain to human services and other committees, as we all know. But I did take out the relevant parts that do pertain to us as human service committee members. Can I just get a sense as to folks, I hate to use the word new, I say newish to the board, and this might be a daunting kind of task to discuss district needs and budget and all of that. Now, so again, I've been doing this for quite some time. I'm not an expert in no means, but I realize it's a lot, right? And the whole point of this is these are needs of the district, right? As it pertains to human services. Now, human services, I guess, spans many committees, right? But then there are certain things that are unique to this committee. So I hope so let me just ask in general, this has been discussed, correct? In prior meetings, and we have would you say, good understanding of the process? Yes, no?
No, I don't. Somewhat.
Somewhat, and you say no, okay. Anyone else?
Yeah, I'm like her somewhat,
Okay.
because new to it.
We worked on a couple of those points,
Yeah.
all of us.
Okay.
I don't know, for example, how is it decided on what to work on and what goes on that
Okay, good question.
document, and I looked at it too.
Yes,
I had a couple of questions too. I like how it started as an introduction about East Harlem and the issues and stuff, but then I don't know how the ranking was decided.
I see.
And I saw that it was sorted by agency.
Yes,
It's just, I think there could be better ways of organizing it.
I see.
Yeah, I agree with that. Also, ways to get the community more involved in taking it, because from what I've seen, I tabled with Marlene at an event to try to not Marlene, Marcel, please forgive me, to see how to get people to sign up and everything, and it's a very daunting thing. Some people were very confused on it.
Okay, thank you.
And to me, my number one question is, what is the purpose of this document?
Okay.
Does it go to the community? Does it go to the New York City and decide on funding?
Yes.
That's the goal, right?
Well, I'll finish your sentence.
So that's because depending on where it goes, then it can be made for that purpose.
So Brad just walked in and,
And if you don't mind, can we wait, because Anya's gonna join me.
oh, yes, yes,
Do you
yes.
mind?
Oh, no,
Okay.
So, every board goes through this process, right? And it's called Statement of District Needs and Budget Request, right? It's an annual thing, every board does this. Now, what has been done in the past in CB11 is each committee is assigned to work on, I would say, aspects of this that pertain to the committee, right? Now, in the past, committee members have discussed, well, we need lighting in grant houses. We need accessible ramp in Metropolitan Hospital, things of that nature. So we're hearing from the board members, the community as a whole as well, because this is an open meeting. Anyone can come to this meeting at any time and present,
Right.
what their needs are. Now, this is what's supposed to happen. So the board hears from each of the committees in terms of our issues, our concerns, right? And then as a board, we have to kind of rank them. Right, that's just how it works. You have to kind of rank them and then also, and I compartmentalize them in terms of, this is something for Department of Aging, this is something for Department of Transportation.
Right, because we worked on it a bit, but
Hi.
but I wasn't sure if the ranking was done among us or just the issues. We spoke about them and then we discussed them, but I don't remember being ranked based on what we all agreed.
No, that does take place. There's ranking involved, because, each committee, again, like relevant to human services, but that we need to rank, things that we feel are relevant. That we might be, depending on what the item is, another committee might say, well, I think this should go higher in terms of, making sure that, we have issues in terms of public safety, and that's our affordable housing. Okay, so, but the board as a whole, we do have the opportunity to have input in terms of like where things stand on the district service needs and budget. So that being said, I do want to make sure that I let you know that what was supposed to happen is, and feel free to those who just walked in the summer, the board sits down with various agencies and discusses these things. And in all transparency, that did not happen last year. I don't know about the year before that, but that needs to happen. The board needs to be in front of the agencies and not just the representatives, the heads of agencies, and discuss our district needs. That's supposed to happen. Hopefully it should happen, it better happen this year. So that's what happens. And then, so again, every board does this. And then, again, that's just something this is how the community gets to weigh in as well in terms of what their needs are. Because again, this is an open meeting and they're able to weigh in as well. Does that answer something?
Yeah.
Okay, yes.
I just want to piggyback because I'm still a little bit in the gray area. So how do we get is this like an open forum where all the agencies come and then how does that happen?
No, so that thing in June in the summer.
Yeah, how does that happen?
That's like a standard, it's supposed to be a standard thing. They know that this is coming. It's not a new thing.
Okay.
So they know that for Department of Aging, I don't know who the head of it right now, is there and listens to the board. That's supposed to happen, and it's the head of agencies.
So do all the board members go?
Also, no, unfortunately.
But every board's
Oh, yeah, oh, yes,
Okay.
because I've often said, that I would like to sit in, but I think it's the chair
Mhm.
but chairs, I don't know. But not every sport, no,
Yeah, okay, I just,
but as the chair, I represent human services. You tell me, and I will darn sure tell them.
okay.
Can I give you my list now?
No, so, so there are things that are here, so please, everybody, take a look at this, dig really deep into these things in terms of, because a lot of these things have been on the statement of district needs for some time, maybe over years. And what's supposed to happen is we review and see, was the lighting provided at grant houses? Was the ramp, constructed at Metropolitan? There's no need for a ramp at Metropolitan. But if there was a accessibility ramp, and what did it take place? So there's always like, we go, we review, did it happen? What was the comment from the agency? They might say, yes, it can be done. They may say, you know what? That's for another agency, or there's no funding, whatever they may say.
Or not enough
Not enough
information.
information. That's like the standard thing. Not enough information. We need more information. So we have to be very specific when we make these requests. We really do. Be very, very specific. Okay, so I guess we'll pause for a moment, and folks joined, and we have our chair and vice chair. Good to see you both, and we have Brad, and I don't remember. I know you don't. Okay, thank you. Okay, so we're gonna pause for a moment. These are representatives from Mount Sinai, everyone. So we had asked for them to come to the Human Services Committee and kind of give us a sense as to the strike that's currently taking place at Mount Sinai, various locations, and Montefiore, which we don't want, that's in the Bronx, but they're here to kind of tell us. And then we will spread this, as community board members, we get the information, we spread it far and wide as well, right? Okay.
Okay, you want to start?
Yes.
Okay, can everybody hear okay?
Yes.
Okay, so I'm Brad Beckstrom. I think some of you know, but I'm a government affairs at Mount Sinai. With me is Dr. Wamberg, who actually is the Chief Medical Officer for all of our ambulatory services. And I guess, in a way, we're sorry that we have to be here tonight. Not that we don't enjoy coming to these meetings, but obviously it's not the most fun topic. But we're going to kind of do this in two segments. I will explain a little bit what's going on, and then Ani's going to talk a little about clinically, because I think that's really the most important part of during the strike, whether it's one day or a week, however long it is, what services are actually available. I think that's probably what you're most concerned about. But we have actually several hospitals in the Mount Sinai Health System, Mount Sinai Morningside, and Mount Sinai West. The nurses at those sites are in the NISNA union. We have a 3-year contract with them, which expired actually on December 31st. We have been in negotiations with them for many months, and most recently, we actually are in mediation. We have been meeting daily with mediation. We actually received from the union right around the first of the year what they call a 10-day strike notice. By law, they have to give us a notice before they strike. That notice was given to Mount Sinai Hospital, Morningside West, and actually throughout New York City. Originally, it was right around 20 or 21 different sites. Some of those locations actually since then have received letters from the union rescinding their strike notice. But really now on strike, beginning today, were the Mount Sinai Hospitals, New York Presbyterian, and the Montefiore sites were the key sites that actually went on to strike. Negotiations continue. We hope that this is short-lived. What we have done, and again, Ani will talk the clinical aspects of this, is we actually secured what we call travel nurses, something that hospitals do in any situation like this. We had to do some of it during COVID and other times. So we do have travel nurses on site. In addition, many of our own staff who are non-union have moved into other positions, some of them clinical, to help offset some of that need. And then we have actually had many nurses who have chosen to cross the picket line. So we have a very strong number of nurses to provide the clinical care. But that really is, our plan. So Ani, I'll turn it to you. Do you want to explain clinically what is happening?
Yeah, sure. I'll keep it short and then you can ask me any questions. It's nice to meet you all. Thanks for having us. Yeah, it's a challenging thing, I think, for any health system to go through, let alone 3 at the same time. I think it's the biggest nursing strike in New York history. Clinically, we are very much open for business. Our outpatient, ambulatory footprint is completely 100% open. All the emergency rooms are open for business. What we've tried to do at each hospital is selectively ensure that the highest acuity services are fully staffed. So like all the ICUs or all the units that take care of the sickest people. The only thing that we've been slowly decreasing are some elective procedures to kind of accommodate, obviously, for this. And this is an evolving situation. Today was the first day. We didn't know how many people would cross the picket lines. We had to make sure the travelers would come. So it's really evolving day to day. We still are doing some surgeries. Obviously, anything urgent is happening. What I would say in terms of messaging to the community is that if you're not contacted, that means it's business as usual. If you're having an elective procedure and we need to push it back or anything like that, we will contact you. So we're doing our best to keep patients safe and provide high quality care and provide all the care that's needed in the face of this.
One nice thing we're operating as a health system. We actually have 7 different hospitals across New York City, as well as many ambulatory sites. And like some of the surgeries that you mentioned, we've been able to, the ambulatory ones, not the inpatient ones, to relocate this like to Union Square, to what we call Chelsea Center. So, you know, not many, but a number of people have had their procedures relocated rather than canceled.
Other questions? Jackson?
Yeah, a question with clinical side. What is you guys' wait time in the ER? Did you guys see like any significant longer waits in the ER because of this?
That's a great question. Not yet.
That's great.
Just started this morning.
Yeah.
Our ERs are not on diversion. So to your point, you know, we're open, so it sort of depends a little bit what's coming in. But I will say, as Brad said, we have a number of nurses that are filling in right now, so we don't anticipate huge changes in our ER. That being said, as I'm sure you all know, it is January and every virus on Earth has attacked us all at once, so it's busy, you know, I'm not gonna say it's not. Certainly we will be monitoring to make sure that our ERs are safe and moving patients through.
Yes, I do. Hi, my name is Leslie Plum. My question is, the ambulance services that are provided throughout your system, have they been inundated with more calls than usual because it is a Monday and the striking has gone? Also, has wait time exceeded usual the normal other days? I know Mondays, I always call it Maniac Monday because all the home attendants start responding. They come to the homes and they find the person they were taking care of, they needed to go to the hospital. So with that, I know that Mondays is always inundated with a lot of more volume. Has that happened, and what is the process of how to resolve that?
Right. So 2 things. You're right about Mondays, and you know, we take patients not only from our ambulances, but from FDNY and any system can bring patients to us. I'm not aware that today we've had higher or lower volume, because we weren't sure. Maybe people wouldn't want to come during this. It's challenging, but I think it's been basically a regular Monday for us, though busy. We do not yet, again, see longer wait times, and I think the ambulance systems shouldn't be affected. They're not part of this union, they're not part of the strike, so as long as we continue to do our part, getting patients in and moving them through, I'm certainly hoping that we will be okay.
The ambulance call at the end of the day, exactly right, that Kevin was saying, but the volume really wasn't.
Yeah.
The ambulance will get affected because if there's not a nurse in triage.
Yeah.
Or assisting because there isn't another nurse.
Well, there is a nurse in triage, it's just a traveler right now.
Right, so if that person isn't adjusted to the flow of the way things go, you know, you have to sign the chart, put the patient
I
in bed.
see you are very experienced.
I'm retired from that department, that's why I know.
The flow is hard with so many new people. I mean, it's hard for everybody. I don't want to say it's not, but unfortunately, we've been preparing for this and we're doing our best to keep the flow. As long as we keep the flow,
right,
hopefully it's not going to back up the ER or the ambulances. I'm really hopeful that this doesn't drag on, but to your point, the longer it does, we'll see, how we're managing.
And, and really, not that this isn't challenging, but with regard, to nurses, we're fortunate in that, A, the number of travelers that we were able to get was higher than we first projected. So we have, I think it's about 100 more travelers or so than we first projected. And then, a good number of NISA nurses have crossed the picket line, so we're, not in perfect shape, but we're in a better place than we thought we might be on day one.
No question. How long is the assignment for the traveler nurses? How long did you guys get them for? Is it for 30 days, 90?
I know it can be extended. I don't know exactly. That's not an issue. I don't know if it was a 7 days at a time, but getting them is keeping them won't be an issue.
Also,
but I don't know how
great
many days the
question.
contract
I'm not
is.
sure either. I think,
Rumors of 3 months.
you know?
I work at Sinai. I heard rumors of 3 months, but I don't know if that's it was a rumor.
I don't think it's,
Yeah,
I
I
don't
think
think,
it's
no one wants it to go
I
that
think
long, but.
it's 7 days at a time. I
Yeah.
think you can
Or
block
maybe
a
told
week at a
them.
time.
Yeah, I think you do have to commit to something, right? Because people are flying here, and so it is a great question, but I think it's gonna be going, it could go day by day. This happened 3 years ago at Mount Sinai Hospital, and the strike lasted 3 days, so just to give you a sense. And then our regular staff came back once that was over. But I'm sure we have to go at least week to week. People can't be here day to day.
So then, just for a sense of do we know if negotiation is progressively moving, or is it stagnant? Is it it's still?
I would say, and this is a little opinion, slow but steady.
Okay.
But we still have a ways to go.
Okay.
But again, to emphasize, we've continued to meet. It's with mediation. They've been meeting daily. Many days, many hours. But there's still a number of things. We're still far apart in some issues.
And it's all those 3 big health systems.
Right.
Your CFO is leaving, right? Or left January 1st?
My pastor retired. About 2 years ago, we got a new CEO, and we got a new CFO at the same time for our health system. And then my pastor, who was the CFO for Mount Sinai, retired.
I'm talking about the cancer center. He came to present to us last time.
Yeah, I think.
Are you thinking of Jonathan?
Yes.
Who was the COO for Mount Sinai? He actually is moving to a hospital in New Jersey. I forget what hospital to become president of a hospital in New Jersey.
It's a big loss for us. Very sad. I'm excited for him, but.
Yeah.
I just one more question. I don't know if you guys can answer it, but what are the asks? Are the nurses that trying to? Because there's a lot of rumors going around about some things like this is what they want and everything. Is there can you give clear indication?
We don't want to get into a lot of the specifics because we want to be fair about it, and I'm going to jump in at any point. But I think fair to say most of the negotiations have been around wages, benefits, workplace violence, and staff ratios have been, I think, the 3 or 4 button areas. And what I only want to highlight is, from a factual perspective, where there's a lot of misinformation. First, with regard to wages, the starting salary of a nurse today at Mount Sinai is $121,000. The average salary is $165,000. And I think that part of the story isn't fully getting out there of what the current wages are. With regard to staff ratios, since the last contract 3 years ago that was signed, we have hired 1,000 additional nurses. Some of those, about half, have been entirely new positions. The other half have been filling vacancies, and our vacancy rate today, correct me, is the lowest that it's ever been. It's like 2%, or it's a very low, it's below the national standard. It's at a very low rate. With workplace violence, and I want to turn my cheat sheet for this to make sure I just run through that list, because again, I think there's a lot of misinformation going on there. What do we do today for workplace violence? We have, as you enter our EDs, we have, I use the word metal detectors, I know that's a little bit of a dated term. We also have off-duty police officers who are stationed there and sometimes other areas of the hospital. We actually have a facial recognition system, it's AI, with AI capability. As people walk in, it does a picture of your face and can match it. The staff does annual, like we have armed intruder drills, we have what they call peak training. And then two new things that we're rolling out now is we're implementing a new visitor management technology. And again, I'm oversimplifying, but one of the concerns has been that sometimes there's so many visitors that creates problems. This helps in tracking that, and those are being rolled out at Sinai, West, and Morningside over the next year. And then the other thing that's going to be coming online soon is a new, and again, I don't fully understand what all this is, maybe Anya, you do, it's a new weapons detection system that, when people enter, it can help detect with weapons. So should we all be doing more? 100%, but again, I don't think it's out there, some of the steps that we've taken, but a lot of it really evolves around those. And then the final area is benefits. And, the key I want to point there is full-time nurses, 100% of their benefits are paid by the employer. They don't have any sort of where, your monthly insurance is split 70-30. So we're proposing no cuts in benefits, but there's been a lot of misinformation there. And do you add anything on that being fair? I don't want
I'm
to
not
come
a
in.
negotiating table, gratefully. So, I don't know. I mean, these are our colleagues. These are our team members. I have only good feelings on this. This is like challenging for us to navigate. I think Brad did a great job talking about it. I don't even fully know what they want us to do. Workplace violence is something that could affect anyone, and nobody wants that, of course. I think the balance is, we don't want the hospital to feel like a prison or even an airport. I mean, it's part of our community, and we want people to be welcome there. So you're always trying to find the right balance of that. Certainly, safety, of course, always very important. So I hope we can find a good balance in these discussions.
I had a question. I noticed that in the media there was a shooting in Methodist Hospital.
Right.
Now, do you have any active shooter training for the ER staff?
We do. We have active shooter drills from all staff. We do drills on the units, in the ER, and even in outpatient. We do it often once a year. So.
It's just that the ER is ground level.
Yes.
So that's such an easy access and more influx of people coming in and out.
Yeah.
And I hope we didn't appear too adversarial. I mean, Anya hit it right, that, the nurses are the heart blood, the lifeblood of the hospital. So we want this to work quickly. So I hope I didn't come off in any way
Not
as,
at all.
callous or whatever. But,
Honestly, I think it's kind of hard for the nurses too. I mean, I don't want to speak for them, but I think they also, are trying to figure out the right steps forward and how to navigate this. So, but immediately, in the immediate term, and for you guys, we're doing everything we can to keep things running and provide good health care, in the city. I mean, this is affecting a huge number of uptown and Bronx hospitals. So there's a huge population being served by this.
Thank you. Any folks online? You don't have any hand raised online. How about you, anything guys?
no, thank you for coming.
Thank you. Thank you so much.
Anytime, please.
Yes.
Well, what do we need? Leftover Santa
Every-
Second, before we come back for something else. Something, yeah.
I'd like to have you, but not for that. It represents, every Monday.
We have like.
Not every Monday.
Some of your current board members, like, Peggy Morales.
Yes.
Candy's.
Right.
So, yeah.
Okay. Yeah, we love to have, folks from Mount Sinai at our regular meeting, tell us about what's going on in and around Mount Sinai.
Okay.
Thank you very much.
Thank you. Thank you so much.
Good luck.
Thank you.
I suggest, I think, maybe next month we could have a representative from the nurses union.
Okay. Nurses. You said you work at Mount Sinai?
I do.
What do you do?
I work in global health.
Global health.
I'm working in one area.
What does that entail?
So I help manage our partnerships, so we have partnerships in Ghana, Kenya, and Nepal.
Oh. Thank you.
That's dope.
So sometimes, that's why I sometimes miss meetings, normally I'm in one of those places.
Wow, very nice.
Thank you.
Thank you.
Nice to meet you. You're welcome. So, and is there, the person, you have the name of the person?
I can find it.
Yes,
I can-
please provide that.
Yeah.
I'll be happy to speak to that person. That was very good. So, as things, this is like something that's occurring right now and we need to know about. They were very good about being flexible, so I appreciate that, and I appreciate what they have to say. And I think moving forward, make sure that there's messaging sent to the community, in terms of, things that happen. So they have those plugging points. Is that something that we plan to send out? Because he had prepared some talking points for the community, and, if it's relevant, if it's updated, I maybe we'll send that out, and it's up front.
But
Well, I think it would, and I don't wanna put them on the spot, that would have to come from the office,
Okay, yeah, okay.
also, I feel like if we're gonna do talking points, I feel like we should also get some perspective from the nurses as well, because it will come off as just we only are trying to push one-sided. Yeah.
I think you can start the talking points that are just they're operating as normal, but not go into anything.
Right.
I think that was, what I read, that was pretty much what it said, like basically what they said verbally, but that was in writing as well, in terms of services are being provided, et cetera.
Yeah, I agree there's a lot of aspects to this, but at least we know people are getting the services
Yes.
and they're letting people know when they can. So they're doing their own outreach. The concern is some people might not hear something and then start panicking. So that's how we get to those people.
That's right. That's like sort of like the messaging in the community.
If you were to go by social media, you would see a clip of a local assembly member with the striker saying, "I'm all for you. You deserve to have more pay. You deserve to have paid vacation. You deserve to have health care," which is not at all what I heard here tonight.
The mayor so I feel like there's two sides and then the truth.
There's always two sides. Yeah.
Yes, yeah, so just, what they're talking about, I've been watching the news, I see who's standing with those nurses, I see that, we see that, so yeah. I don't wanna get into the politics of it all, my concern is our services being provided to the community, and in terms of what they're asking for, we hopefully that works out. Just talking about mediation, let's hope that mediation is going well.
Yeah.
Thank you, everybody. Any final questions or concerns?
According to what I saw in Grey's Anatomy. Traveling nurses tend to be significantly more expensive.
They are.
Yeah.
than
They are.
nurses, so it's not in the hospitals.
And they don't do the job as well as
Exactly, because they're not used to it, kind of flow isn't to do with it. So I'm sure there is a lot of push from both sides to get this resolved.
Yeah, as a matter of fact, when I was at Metropolitan in the cab, I was well aware of during COVID, and we got the data in terms of the costs. So I know very well, I was gonna bring that up, in terms of the expense and how can, you're saying we have these traveling nurses, but, how long can you keep these? You
and
asked
all the
the question
postponed
about the
procedures, a
contract,
lot of
et
money for
cetera.
the hospital.
Yeah. So, we'll see. As it comes, question.
We could follow up in an email. Maybe there's a way they could send a mass text or something. They probably have the numbers, everybody, just letting them know if you don't get a call, your things will go as planned. So we could send that email later. They're the ones with they have a database of who their patients are, right?
My better calling it, I'm 4 a.m. got a call, I was like, oh, there's no need for a call at 4 a.m. telling me that there's gonna be a strike. They're like, you still have to go to work.
Yeah. My mom got that same message.
So you send a text at 9
Yeah.
in the morning.
Well, you're being informed, so that's good. That's a good thing. All right, thank you. So let's get back to this, in the time that remains, everybody. So, goals. So my thought was to all look at the mission statement of this committee, and that tells you where we need to go in terms of, what this committee is tasked with. Are there questions about the mission statement? We all have it on, we can pull it up.
I have it right here.
You wanna do that?
Yes, the human services. The committee mission is to advocate for quality service delivery that addresses the health and service needs and improves the quality of life of East Harlem residents. Yep. And then it goes on. I guess that is the mission. And then what else goes on? It says the Human Service Committee works on a range of public policy issues pertaining to the provisions of medical and mental health services, social services, and programs and services for seniors. The committee works closely with local services and nonprofit organizations, elected officials, and government agencies, including but not limited to DOHMH, HNH, DHS, HRA, DIFDA, MOIA, OASIS, and OMH. And that's where it ends. I don't know who created that mission statement.
It was, you know, the committee, maybe not when I was on, but that was the committee, my guess and concerns of changing.
I'm not going to say in terms of changes, but I think that very second paragraph, you know, it specifically mentions seniors.
Yes.
And wow, don't get me wrong, I love seniors.
Yes.
I have them in my family. I work with them, but it doesn't capture all the it doesn't capture just all of East Harlem residents. That second sentence to me it comes out saying like, hey, we're doing it just for seniors,
Okay.
where we're doing it for more than just seniors. That's how I read it, but I could be.
Well, let me say this to you, Chancellor. The original name of this committee was, anyone here, Adam was here and Jose.
It was senior in the name.
It was
Health, Human
Human
Services, and Immigration.
and seniors. So there was like, wasn't there mention of immigration within the, okay.
So that just only mention of immigration is just one of the government agencies that we work with, which is the Mayor Office of Immigration Affairs.
Okay. So, you know, so that was the name of this committee, all right? And the whole idea, I think it was you know, whittled down to human services because human services entails humans, services. So it entails all of these things. It may specifically mention aging or seniors, but it entails seniors and everything, human services, age, LGBTQ population, seniors, immigrant population. I can name so many different communities. And the whole idea is to make sure that we are servicing all of these folks in and around East Harlem.
So maybe we update the mission statement to really reflect that. Maybe even put the definition of what human services is, so we can capture that, right?
So that's not a goal. That's something we should just do. We should just do. So feel free to everybody kind of like provide some input. You want to send it to the Human Services Committee email address, me, the whole committee, and we can look into that. So I do appreciate that because that's what happened. That was the intent of this committee is to, now if you want to actually see the wording there, happy to you know, make that happen.
Yeah.
Anyone else? Oh, so that was a mission. So in terms of like moving forward, everybody, I think it starts there. You know, we gives us a mission statement. It starts there, and you name various agencies and community stakeholders, all of whom we should be hearing from at each and every meeting. The head of it, okay, get the commissioner of so and so here or a representative, but we need to be hearing from all of these entities, and also I say agencies, but also community stakeholders as well. We have a lot of human service entities within in and around East Harlem. So we need to be hearing from all of those folks, and they should be at the table as well. Okay. Anyone else? Question, Rob, you moved your hand up.
No, sorry. Just scratching my head.
You have a hand up, Tamika
Oh, yes.
Mapp.
Who's it?
Tamika Mapp.
Oh, okay, yes. Tamika. Yes. Unmute and speak. We can't hear you if you're speaking.
Tamika, you're still muted.
Still muted. I believe she's our district leader, among other things. You're still muted.
Hi guys, hi Jewel. Thank you for recognizing me. It's Tamika Mapp. Yes, I am your district leader. I just have a quick question. How is the Human Services going to be interacting with the cabs, like Metropolitan's cab, Henry J. Carter's cab, for this upcoming year?
So you missed the beginning of this meeting. That's when I discussed the cab. So cabs. So I hate to rehash all this again, but obviously I will, because there was a question asked. So, as folks may or may not know, I recently stepped down as chair of the CAB at Metropolitan Hospital. That was in September. I have been a part of Metropolitan Hospital's CAB for many, many years. Again, I stepped down in September. I would like to hear from all of the CABs in our area. That would be Metropolitan Hospital, Harlem Hospital, Henry J. Carter. We should have folks, first of all, CB11 representatives on the CABs who then appear here at Human Services to speak about what the CABs are doing, and what the CABs are doing then goes back to those hospitals as well. That's something we should work on. Now, Metropolitan has been, I was on Metropolitan, but we do have Carlos Diaz, and I speak very frankly. He is your representative from CB11 on the Metropolitan CAB. We should be, I'm sorry, but we should be hearing from Carlos Diaz. And technically, those who are on CABs, Metropolitan, Harlem, Henry J. Carter, sit on the Human Services Committee. That should be a standing agenda item. So that is my hope that happens. Now, if there are folks here who wish to live near Harlem Hospital, live near these hospitals, and you reach out to the folks. I'm happy to tell you who to speak to at Harlem and Henry J. Carter. There are folks there that I know I still keep in touch with. You want to join that CAB? You want to be you want to be the CB11 rep? Speak to our chair and work it out. And yes, we would like that representation. But did you have a specific question or concern? Tamika? Ms. Mack?
She's still on mute.
If we're speaking, we can't hear you. But that is the goal, to have that representation here. Yes. And even Mount Sinai has a CAB, has a community advisory board representative that we should be hearing from as well. Now that person should have been here right today, could be telling us, well, this is one thing. But yes. Did you have a further follow-up or question? If you're speaking, we can't hear you. Okay, guess not. Oh, all right, well, if we hear back from Tamika, I will be happy to answer a question. Moving on, so we're talking about goals. So one thing is to talk about a goal for the committee, but there's another thing to provide a strategy for that goal. So one of the goals might be to have representation here from the CABs. That's a lofty task, because really you have to find CAB board members willing to serve on the CAB. Now, I can tell you exactly what happens on the community advisory board. I can tell you what happened on Robin as well. Robin, so just everybody knows, Robin and I go way, way back, a decade. When we served on Metropolitan together.
Before I turned gray.
And she can tell you, I can tell you the perks, and I hate to start with the perks of a CAB, because you do get a stipend. That's the reality of it all. You get a stipend. That's like one of the only boards you may know about where you get a stipend to attend a meeting. But outside of that, you are you're advocating on behalf of the hospital. I happen to live across the street practically from Metropolitan Hospital. And let's not talk about the sanitation garage that sits there. That's for another day.
So how long are the typical CAB meetings, Jill?
In terms of
a typical CAB meeting, how long is it?
An hour and a half.
Once a month?
Oh yeah, once a month, right. So the Metropolitan CAB meets first Thursday of the month. At the time I was on, it started at 6:30, my last hour and a half. So basically, the public is listening. Members of the public, please go to your community advisory board meetings, because you have the leadership of the hospital at the table at each and every meeting. You have the CFO, the financial person, the CEO, you have the chief nursing person, you have all these people at the table. You could say good things about your services at the hospital, but you have the opportunity to say, some concern. But more folks should be going to your CAB meetings, Metropolitan, Harlem, Henry J. Carter. So you have that, and then there's a standard, operating procedure of the CAB. You have, you hear from committees, you discuss with the committees, and same with the community boards. all of our work happens at the committee level, and it is presented at the full board, and the full board, as I said, meets the first Thursday of the month at Metropolitan Hospital in the conference room on the first floor.
And they feed you.
And they, I was gonna say, that's the other part, they do feed you. Julia John is the current head of Metropolitan Hospital, et cetera, et cetera.
You get a transportation voucher.
Well, that's that whole stipend, so yeah, it's $50 actually.
So just doing a quick research on this, right? I don't even see when the meeting is. I think that's not fair to our community. If we talk about wanting to be part of this board, you want one of us to be part of it, or even saying like, hey, community members, go to these meetings. There's nothing online to tell you when the next meeting is.
Are you on the Health and Hospital, or are you on the Metropolitan's?
I just search.
So if you
I searched Health and Hospitals Community Advisory Board, and nothing popped up.
Okay, there is a site. I'm
on a site for Health and Hospitals, but it doesn't even detail.
You have to go in. You could go into Community Advisory, but you'll see it there because they list all the different hospitals and the different cabs. My name might still appear there as the chair, but it's there. They have it's there for Health and Hospitals. I'm not defending health, but they have a site.
I know, and that's what I'm saying. So by you saying that, but then just as someone who's very tech savvy, and if I can't find it already, just take somebody who's not as tech savvy as I am, they're gonna have a hard time finding it as well. So is there any way we can like start pushing that out in the newsletter? That hey, these community advisory board meetings are this, and this date as well.
So what are you talking about there? The new CB11 newsletter?
Yeah.
Oh, okay, that newsletter that goes out. Oh, that thing. Oh, yeah, sure. Yeah, and have the actual different.
Not mine. Yeah.
And I think there was some special newsletter you were starting with the.
Social media.
Okay. Yeah, sure. The actual dates when they meet. So like you'll see like the full board. You won't see like a committee because that's the full board. First Thursday for Metropolitan.
Thursday 5 p.m.
Yeah. So I just found Metropolitan. There's 5:30, but Carter wasn't on there. There's no information for that one. And then going to Harlem site now.
Okay.
And yeah. Yeah, it just says who the chairperson is. It was just Miss Booker, but
that is not recent. Harlem Hospital?
Yes.
Unless there's been a change there. But anyway, I don't want to.
But yeah, but that's what I'm saying. So
okay. Yeah, I think that's more of a law. That's a larger issue of like health and hospitals. But we can provide. Maybe you know what we need to do is actually reach out directly to Harlem Hospital's CAB, and that's not difficult. Just so you know, the health and hospitals, and Robin, they have a, what was it called? There's a meeting of all the council of cabs.
Council of
cabs.
There's a Thursday, Wednesday. There's a website that says,
let's say that, which one?
It does it for my 5 boroughs, Manhattan, I can see Carter, I can see Harlem, and Metropolitan.
Yeah.
Looking forward.
Yeah, so that's what I see as well, where they list each hospital. Okay. But if you click on those links, only Metropolitan had a date and had a it was
I'm sure that it was there.
So that
no, but there's a council. Thank you, Rob. But so I started to say there's a council of cabs that they meet down on Water Street, where all of the chairs of cabs go to this meeting, and we meet with the leadership of health and hospitals. Mitch
Kaplan.
No,
Katz.
Mitch Katz, and other folks are there. So again, you want to speak about things you have concerns about with hospitals or hospital, they go to the council of cabs. So I can put you in touch with the current, and with that structure, there's a chair and all that of the council of cabs. And that's an open meeting as well. Downtown, they feed you there as well. Health and hospitals, I guess, I'm good about feeding folks. But we can do, they can all do better in terms of getting the information out there. That's just a given. That's unfortunate. And Mitchell, it's not a new leadership at Health and Hospital. Mitchell Katz has been there, and I believe he's staying on. So that can be better. But other questions? Okay. in terms of, so, I don't wanna keep it pushed, I do wanna really have folks say more about goals, so thanks, Chancellor, for some ideas in terms of us moving forward. And, happy to hear of others if you have now, or think about them, some things. And then I'm gonna move on to, and then, so that was the, what are your goals, but then also we, to discuss strategy for accomplishing those goals. Anyone else?
I'm wondering, like, is this a reset for, I think it's this question, is this a reset for the committee, or is it an expansion upon, or, I don't know if we talked about this at the beginning as well.
So, no, it's not a reset. This is something that the committee should be doing. If you look, I would like to discuss, basically, old business, if there were some things that need to be followed up on, and I'm happy to do that under old business and new business. But for my purposes, again, I'm not new as the chair, and I think we should start by making sure we're all, aligned as to the mission of this committee. And that comes right from our mission statement. That's not a revelation, that's the reality. And moving forward, we have a task to do, and we should, we should make sure that, we hear from our representatives and hear from our community in terms of what their needs are. And this is, everybody should have a seat at the table. So there's no reset, no, this is just, chairs move around within the board, that's just the reality of it all. There was a chair that, there's a new chair here, and that's it.
So like our former goals and objectives.
Well, that's what we'll discuss that, when the discussion will follow, old business. Happy to discuss that. Yeah. Oh, yeah. Tim, yes?
I'm gonna meet with, all the staff tomorrow, with Jose, and we're gonna do that first. We'll talk to each liaison for each committee, that's why they're gonna be there. And to kind of understand what you've been working on. And then if you wanna put the goals down that you originally had, just to make it easy, put that in one spot, share it with us. I think there's always gonna be some changes when, there's new leadership, but I didn't hear anything, unless I missed something that said it was gonna be a complete reset. I just think, as for our first meeting here, this is probably like that necessary transition. Then, it would be, I think, like an introductory meeting with a new chair of the committee. With that said, I will find out from the liaison, we're gonna meet with the chairs and the vice chairs. Since you were on the committee and Jewel wasn't, I think that would be valuable for you to talk about what was being focused on, if you don't hear Jewel talking about that, and what outstanding things you had, or if there were any projects you guys have been working on, because I think then you guys should see those through, and if there was things this committee was doing and that maybe it isn't part of Jewel's vision, I'm sure Jewel will consider it. So, I don't know what else, and as far as my vision for this committee, I'm not here to have visions for the committees, that's why there's committee chairs. It's, you guys are here to do the work, I'm here to support you. I do have ideas, and I will share them as time goes on, but I think that, I'm here to observe first, see how the work goes, and support it along, and make sure that whatever the committee feels is necessary and whatever the community needs, right? So that's really it. And I do think that things can also just change from time to time because things happen. When I was chair of housing, we'd be focusing on certain things and then something else would come up and things had to go on the back burner. But I think there can be a combination of what Jewel brings and what you guys were doing prior, and I think that might be a nice balance.
Thank you. Anyone else? Yes.
I think there's just a little bit of unsettling here, because of the way in which this change has come about. And to learn about it through a series of emails is kind of abrupt. And I think some of the things that that were written about in terms of what this committee should be doing versus what our leadership had us doing are not particularly, were never really discussed. I'll give you an example. We've never talked about all of us showing up at senior centers to show that we're involved, we care about senior centers, or that we're involved with senior centers in the community. Never discussed. Some of us do that because of the nature of our jobs. But I think it would be great for us to have a roadmap, if that's what you're talking about, so we all understand what the expectations are, what we got sent to us was never something that was laid out for this committee.
I think,
Is that
so
fair?
like, and to walk with that, I think it's hard because this all came about and I don't think anyone in this room, to my knowledge, was a force in what happened with our last year with Xavier. And so I feel like there was like this abrupt change and then all of a sudden new leadership comes in. And so it's like hard, but it's like, I have complaints, but I can't complain to any of you because none of you were the ones that did it. So I'm like, I can't be like, I'm mad at you as a
You can
chair.
have a complaint, doesn't mean you're mad at me. So,
Right.
I mean, I'll listen to
But
your
you know what I'm saying? It's
No, I
like-
mean,
it's like, I think what Xavier did was really unfortunate and a poor show of leadership, but how do he's not here anymore, like he's here, but he's not chair anymore, so it's hard to be like, this was unfortunate. And it's hard because like, I think Joel's great also, so I'm not like mad that she's here, but it's, I can kind of understand.
Usually after most elections, there are changes done. This is, I've been on this community board for 15 years now.
But I think the thing is, are the changes normally done by the outgoing
Well, no, yeah,
chair?
no.
So that, I think that's where it comes in.
Well, I'm sorry, so I'm a stickler for just please raise your hand.
I've been raising my
I
hand,
realize that,
yes.
so I'm just saying, just please,
Yeah.
moving forward, just, but that, yes.
So what I wanted to say, because I'm new to this board, it was very upsetting to me because I'm like, what did I sign up for? Right? And then, I was just getting to know the chair and kind of still trying to figure out the dynamics of, I'm still asking questions about how things run. So I was very disappointed, just for the energy, right? And then I ran into the chair in the supermarket. So of course I'm gonna ask, like, what happened, And I could tell that he was like disgruntled. So I didn't elaborate, but it still didn't feel good, right? Because it wasn't like good luck, or whatever. It was, and it's like, it made me a little sad because even if you move away from something, I wouldn't want to, you might say this no longer serves me or doesn't meet my values, but I still can't figure out what really happened. So, it just made me a little sad, like, because I'm like, this is a volunteer. We're coming outside of our homes to meet certain goals. And I don't sign up for like Discord and stuff like that. So I'm a community person. I was happy to join, and I'm still like not confused. I have not read every email because I thought that's like tedious. I would rather someone have a conversation with me. So that's why when I ran into the gentleman, I wanted to talk because then you can feel the energy, feel how somebody, their emotions. And when it was a little like, I didn't want to upset him. So I was just like, okay. And then he said, we'll probably run into each other some more. So I guess he's still like upset. And so maybe if I see him again, it'll be different. But I didn't think that was the right time to have a come. But I'm still like, what did I sign up for? You know what I mean? And I was happy before this and I'm not unhappy. I'm just confused.
I understand. I appreciate everyone sharing their thoughts. I can only say that, I go where they tell me to go. And I'm gonna do the best job I can where they tell me to go. And again, I'm not new to this committee. I hear what you're saying. I can't speak for, I'm not, because to me, I can't speak for what took place. I can only move forward and I'm sorry if that sounds like, people are maybe, there's some unresolved issues. But if you want to move forward with the committee, I'm happy to work with each and every one of you here for the benefit, and I'm looking for the benefit of this committee and this board as a whole as we move forward. But I do appreciate everybody sharing. But that's all I can say at this point. Anyone else care to share?
What about like goals or just in general?
No, just this last bit of train of thought here because
It's unfortunate, and you see these in things. I think sometimes Xavier and Isaac both had the betterment of this neighborhood in their mind. Sometimes visions don't overlap. Sometimes those distinctions happen. Regardless of the fact, I think it's getting more personal than community for many, many months. It worked out in its own way. Again, that happened prior to us starting, you know, and it kind of like spilled onto us in an ugly way, which I ended up having to clear up because it got really like confusing to everyone. Not just you.
Yeah.
I was confused. I was like, and I know everything. I'm like, what's going on? I'm like, so understandably,
You got the lotto numbers?
I wish you
Nah,
want to be
you said
here.
you know what?
1.8. I want to use it for the 1.8. But you know, that's just how it goes. And I think
Can you introduce yourself?
Sure,
I don't know your
Jose.
names.
Jose Altamirano.
Sorry.
I've been living here for 15 years. Typically, I'm on public safety, echo, executive, and oversight, board oversight, which changes. It's changed.
Nice to meet you. I'm Robin.
I've seen you before. I've seen the hair. Remember the hair?
Oh,
Love the hair.
thank you.
I lost my hair before I got peppered. I was hoping I got peppered before I lost it, but I lost it first. So no, you know, I don't want this to like stop what the work of the community is. People very knowledgeable in this, has experiences. All of you are here. You're all volunteers, right? It's like you're here because you want to be, other than like the staff, because they don't want to be here. But in general, like, you know, you're here to do the work of the community. So we can, you know, I just wanted to talk about it so we can kind of let it. It's not. I don't think it's something to do these like heavy investigations in. I think a lot of it was personal, and just, you know, some people just don't like to. That's what it is. But you know, we can always. I'm open to conversation. We can have offline. Currently now the vice chair of the community board, and you know, I'm going to focus on kind of just like having these conversations, getting to know everyone, making sure there's flow, and then gets to like do the harder work of like all these meetings and all these other things and borough presidents, and I think that flow will kind of bring us together to, you know, have very like functional meetings.
Debian?
We develop relationships here, we develop friendships. You know, we can't just put our feelings aside because, you know, somebody leaves, we still have those feelings of whatever happened. But I think we have to also remember what we signed up for, and that wasn't to, you know, be talking about our feelings. You know, we should get along, but I think there's been a lot of distraction from the work in these past few months. I think a lot of it's just a lack of communication. I think a lot of times people could have sat down and talked and hashed it out, and it spilled out into the public. I thought that was not appropriate. I didn't think it was handled well. It won't be handled like that by me. Chairs will make tough decisions. They'll make decisions that people don't like. But if I make a decision, it'll be fair and it'll be communicated. It'll be transparent. I think, as you've already seen, you're probably going to get too many emails from me. And the reason this board oversights, you know, it wasn't my idea, full transparency, but I pushed it through quicker, because I saw a need for a place for this to go. These types of feelings, these grievances, they shouldn't be ignored. They shouldn't be swept under the rug. They should have a proper venue to go to. Anything that needs to actually have a decision made will then go to the full board. If it needs to be handled sensitively, we'll go into an executive session. But my thing is maybe to try to compartmentalize that, so we're not having those debates at full board meetings in front of the public. You know, you don't fight with your family on the street, right? You go inside. Like, you know, what message are we sending to the people that we're supposed to be advocating for when we can't sit together for 2 hours and, you know, just get along? And even if there is a difference of opinions, that's fine. There should be. There wouldn't be a need. If we didn't have different opinions, someone could sit at this table by themselves and just do whatever. So, you know, keep that in mind. So, thank you.
Anyone else?
So are we moving this to 6:30 now? Or?
Yes, so, all the other, yeah, that's on my agenda to discuss this. Oh, that's the email I sent out. The only other committees meet at 6:30. I'm not sure why this met at 6. All the other committees, the full board meets at 6:30. So, and this had been meeting at 6:30, you know, ever since I was on this board. So not sure why it's to 6, but the plan is to go to 6:30. Is that a concern for any folks here?
I would prefer 6:30 too, if possible.
That's the plan, 6:30, because to be consistent with all the other committees. That was the plan. Thank you for bringing that. That was part of my agenda as well. just discuss. 6:30, starting in February. And I've reached out to our the community folks, agencies, and introduce myself and let them know that that's the plan. And that there was gonna be a discussion about 6:30, so I started doing that. Anything else you can do that? No. Anything else? So back to the agenda again, everybody. So just so we kind of just make sure we've actually touched upon everything that was on the agenda. So we went through those goals, strategy. If you have goals, strategy, feel free. Again, you should all take a look at the district needs, and specifically those areas related to human services. Happy to let you know where to focus on. Again, I parceled out within the district needs, the areas that, as it relates to human services, happy to send this out, pages that you should all go to. But you should all be very familiar with the statement of district needs and budget requests. And then I do have under old business or based on the committee discussion for follow-up. So that was the part of the agenda where there were some things that were you were working on. And so just so you know, everybody, I actually looked at all the past agendas and minutes. I did. So if there were some things that need to be that you were focusing on, that you want to make sure that it happens, that was the part of the agenda where I was going to discuss that. So that's that opportunity to do so. So yes.
Chancellor? We're talking about old business, correct?
Right. So things that you're working on that require further. We need to follow up with some folks, or we had a presentation. Maybe there was a request for something from the board or from this committee. Yeah. This is your opportunity.
So back in November, this was actually part of the district need. We found out that Grow NYC was closing for the season. So there's only 2 in East Harlem. There was only one that ran year long, the one on 125th and Park, right underneath the thing. So the garden every Wednesday. So we're going to reach out to invite Carrie King to tell us what's going on, what's happening, why is it closing down. Usually, I think Carrie King speaks at economics, but humans feeding people is a human service. So I sent that to the former chair back in November. Carrie didn't get to make it in December for the December meeting. She's not here today either. But I spoke with her during the what's that part? Marcus Garvey's Christmas tree lighting. And she explained that Grow NYC closed all theirs throughout the city. And what Carrie King and her team is doing is every Wednesday, I think they're starting back up next Wednesday. They're actually doing it themselves, providing fresh produce to sell to our community. The only downfall is they don't have the SNAP because that is tied to Grow NYC, and USDA is not going to allow it. So there is going to be a form stand for as long as they can do it. She said every other Wednesday. They can't do it every Wednesday like Grow NYC. So that's an update from old business dealing with the food.
Do you want to have Carrie speak?
Yeah, I mean, to give us an update,
Yeah, I know her very well. And Diane Collier, who she reports to, was a former chair of the board, former board member. And I said she reports to, right. So Diane Collier. So either one of them we can reach out to and hope.
I actually just spoke to her about this. What meeting? We're going every meeting.
Yes.
But I spoke to Carrie about this about Marquez.
Wow.
And they're doing a toy drive for Workforce. And they obviously are not getting what they normally get because it's winter time, so they can't get local produce. What they're doing is they're bringing up from North Carolina. They're doing it every 2 weeks.
Every 2 weeks.
Okay.
Yeah.
But you still want to hear from her direction?
Yeah. I mean, appreciate that. Farm stands are used for feeding people. Is that
say no more, Chance.
I care about feeding folks. Maybe it's the southern meat. Yeah.
If you haven't bought it, it's great produce. She gives you these little recipes where you can what to do.
Exactly. Yeah, so we'll reach out. I know both of those individuals. So yeah, we'll reach out. Yes, excellent. Yes, other things that we need to follow up on? Yes.
It's a little premature, but we talked about the fact that the district survey needs to get out to more people, and we had identified a way of doing that with older adults through Hunter, through the Silverman School of Social Work.
Excellent. And is there a contact person that?
Dan Gardner.
Oh, Dan from Ken. Dan. He's okay.
He's okay.
That's good.
In fact, he's also chairing a committee to revitalize their annual aging summit, where people can present about how do you grow a community for older adults. And so and I'm on that committee, so if anybody in this committee wants to make a presentation, please let me know.
Or you could put the survey link on the Instagram profile.
I think the survey link is on our website, but that doesn't mean it gets to older adults in the community.
I have to take a moment because when I was in the cab, Dan Gardner was one of the cab members, and I'm so glad that he's doing. First of all, he's doing okay because he had some health issues. But yes, Robin, please give him my information and tell them I want to see him.
Oh, okay.
Please do.
Okay.
Please do. That's great news. Thank you.
You're welcome.
So we're talking about older adults, and this is a mechanism to reach them, and you're going to go.
It's a mechanism to grow the number of people we bring the survey to.
Okay.
What's the point of doing the survey if 33 people respond?
Right. That's very important. Yes, Leslie, come on. Oh no. Is the emphasis on prolong?
Okay. The NORC programs that we have in this community.
Yes, that's right.
All the NORC programs. I mean, there's one in Franklin Plaza that I'm very involved
And
with.
please, you want to tell us the acronym?
NORC stands for Nationally Occurring Retirement Community.
And there exists here in East Hall. We should do more about that. Please go on.
Yes, so there was a gentleman that was working in Taft Johnson? No.
Taft.
He was working at Taft and he wanted some letter of recognition, but he only has a few people. I have, I think, almost 200 members within Franklin Plaza. Some of them are homebound, some of them have home health aides, and they're just getting old. But we do have different volunteer services for them. That'll be a good survey to have for that. And there's another one at Jefferson Houses as well. So there's a lot of NORC establishments here, and it's through Union Settlement.
Right.
So you can get them to filter out, and they can also tell you what are the needs that they could use. Like I have a crocheting, I have a knitting, I have jewelry, I have arts and crafts, I have yoga, chair yoga. I have a whole Mandarin section for the Asian community to do their Tai Chi. We have that in Franklin Plaza for the Franklin Plaza residents. So if other agencies, can benefit from that, can help them as well. Just to see the services, we just got one of the health services for the family members that are homebound, but they don't have any patient advocate. We have an agency that comes to the house, and if they need to get blood work done, if they need to get x-rays done, if they need something done in the house, that agency will provide the services for them. If their medical coverage is covered them. Who knows about healthcare now? But this is what my NORC in Franklin Plaza is providing for our residents. So if you want to ever come down, the office is open Monday through Friday, 9 to 5.
You would find, we are a designated, naturally occurring retirement community. That means something. So you all should just look that up. That means something. We should be doing more as it relates to that. So that I appreciate that, but we should be doing more as a committee because we are designated as such.
Yeah.
And that would also entail our elected officials too. So our council member Encarnacion, yes, I got it right. And reach out, and our Senator Serrano, our assembly person, all these folks, assembly person Gibbs, et cetera, And just, how are we benefiting as being a NARC? A NARC. Not a NARC. And what can be done, actually? Yes.
Was someone following up with, was it Joseph Davis? That was his name, right?
Joseph,
Was that his name? From last week, from last month?
yes, I did, as it relates to my organization.
Okay, I can follow up with him or someone, because I know we wanted to follow up with him about the language for the letter.
Oh,
For what?
He requested a letter but didn't have language, so we're gonna follow up with him to get language for a letter of support.
Say that one more time, I'm done.
he requested a letter of support, that's why he came.
The NORC TAF.
Oh, that more that. Got it. Maybe that's why when I saw that, I was gonna say we need to emphasize the book. Thank you. Okay. And the individual's name again, I'll look it up, I have a few minutes.
Joseph
Did you
Davis.
say you were gonna be, what did you say?
Okay.
Okay, appreciate that. So just so I know, the person came before us and requested a letter of support specifically for TAF and their naturally occurring.
The NORC, the TAF NORC program.
Okay, and that was when again? The last meeting. Okay.
The December meeting.
Got it, okay, yes, got, right, yes, thank you. Yes, what else? Oh, 9, we have someone, who's this person?
Sandra.
Yes. Please say your name and where you're from, please.
Yes, good evening. Thank you. My name is Sandra Talavera. I'm a longtime resident of East Harlem. I'm the Director of Community Engaged Research of the Rivera Mint Lab. We do brain health education and equity here in East Harlem. I wanted to follow up on Robin's suggestion because as an active member of the East Harlem Community Health Committee and Older Adult Subcommittee, we do meet on a regular basis with a number of the NORCs in addition to the older adults centers. And so if there's anything that we could do to support that effort in terms of the survey, Joseph Di Benedetto is our active chair, and we work very closely together in the community in terms of older adults issues. Thank you.
Thank you. And please provide your info. I know you, but provide your details maybe in the chat perhaps, or send it, and connect with me, and happy to follow up. Thank you so much.
It just says that the chat is disabled.
Oh,
It has been for a while.
okay, sorry.
Sandra's presented before.
Yeah, I know it, yeah. Yes, as long as you have all of your information and I get it, that'll be great. Thank you, yes.
I mean, there's an easy solution. Maybe I'm circling back for a second to getting district needs or any surveys we're doing. I mean, we don't just have to sit here and put it out on the internet and hope people fill it out. You go to NYCHA tenant meetings, if you go to, you want senior feedback, go to White Houses, they're all playing bingo and this. I'm sure you could sit there and fill it out with them. We start coordinating things like that. I think that, we have to be careful how we do it because, open meetings law, but we're able to do the walkthroughs of NYCHA housing. We can go out on foot, 50 flyers, you come back with 10 filled out, start doing it now. I don't see why you couldn't get hundreds by the time we're done. So, and on that, and I'm not gonna talk anymore tonight. It's a lot for me with all the committees, like to know. So if you guys need specific support from us or anything, have a thing, send us kind of like a quick thing. I don't know, if you need us to follow up or say, whatever it is, like almost like a little cheat sheet of what you need. I mean, I'll be looking at everything too. I'll be coming to the meetings, but that would be helpful, so.
Thank you, Dan. And just as Robin was saying, in terms of making our way to the senior centers and things like that, happy to do that. Others? Again, these are things that you were working on and may need follow-up or I need to circle back, et cetera, et cetera. Well, as you recall, feel free to let me know. That was old business. We are now at new business, based on the committee discussion for follow-up. So, new business, folks. What else we doing? Ada, is it Ada? That's how you
Yes,
pronounce it? Ada. How about you? I like calling up people.
If I have any new ideas, what about?
Just your thoughts about the committee.
Well, I mean, I'm a new member, but so when I used to come to these meetings, I didn't know what was really being discussed. Like, it says old business, new business, but they invite some speakers and they show us, and then that's it. So there was a couple of documents we worked on that was fine. So I would have liked to see things a little bit better organized.
Okay.
And distributed earlier. And, maybe we can actually say what's gonna happen rather than new business, old business, to what they are.
Good guy. Okay, good. Appreciate that. I'm going around. Robin, you're next.
I don't have anything to add.
Thank you, Robin. Tanya?
To piggyback, because I'm a new member, so I share some of the same sentiments, but I like a little more, I wish even new members had like an orientation. I know they had something on a Zoom, but I was like working, like it was for overall new members and I just couldn't do it. But like, once we become a board member or even a committee or orientation or something, because I felt like her, I was like sitting here and I had no clue from what was happening. I've sat on other organizations and I've been on boards, so Robert's Rules of Order, you know all that kind of stuff, but like the content, I was like so confused, but I am also an observer. I'm not expecting to know everything right away. So my goal is just to sit, listen, and hopefully catch on. I haven't caught on quite yet, but that's the goal. And I do appreciate you were really open about like explaining things today. So I really appreciate you. Because I haven't felt like that in a meeting where like you were willing to like break stuff down.
Sure.
So I thank you for that.
Oh, you're very welcome.
Okay.
I appreciate that. Thank you.
No, it's really, I'm honest about that.
Mr. Gray?
Yeah, I'm on a thing, so there's multiple things that I got on my mind with the committee. One thing being more accessible and seeing things, right? Actually, like in our Google Drive, our drive is literally one of the, our Google Drive is literally one of the most accessible things you can find, but there's some stuff that are still not in there. Dan could test because he was in the last committee meeting because he's going to all committees meetings right now. So I've been taking a close look at our website and see how we can improve our website specifically for the communities I'm part of, because while like our whole thing of getting people to actually do the survey and everything, right? If we're driving people to our website, it needs to be easier. People need to know what's going on. Things need to work. So I did something for environmental open space parts, and I'm looking at ours as well, human services for that. And then also going to be working with another community member about social media, right? Getting our social media back up and running. So there's some ideas coming along, and I want to make sure that human services is definitely highlighted in that. I know that in environmental open space, we're doing community garden tours in the summer. They did parks in last year. So thinking of what Robin was saying earlier about going to see seniors, I think let's visit some senior centers. I can't really visit the NYCHA ones because of conflict of interest.
Mm-hmm.
There's blurry lines, and I don't want to go down that route. But I know there are others, like the art center is like right down the street from me. So I don't know, maybe we can do that. Something that we can do with all. Actively, participate in a committee, actually see things that what we're doing, like Otto was stating, we said we do letters of resolution, we're doing letters and support things like, let's actually see them, letter of support and stuff.
I respond to what, so I was on Parks, Open Spaces, blah, blah, blah. Yeah. And I was part of Parks when we went to community gardens.
Mm-hmm.
I was part of that tour. We did it over the summer. And I'm gonna say this, so that was, that's when Jessica was the chair and Malik, who's still the vice chair. And I'm just transparent, Malik was the one kind of like set up that whole, the tour, reached out to the folks. And that's how we went to all those community gardens. We did parks as well. It's nice that they're circling back, but I was part of that committee when they did that, and it was over the summer. So June, July, yeah, we did that. So happy to have that happen here. Those entities that we should be going to, happy to do that. We need to kind of just get a sense as to where and those folks that are in charge, and set up like when we can go and visit.
Yeah.
Okay.
Yeah, because I think just a list of what senior centers are in this area, what places have social services, what CBOs are available, like where's that list for sure? Like I know there's something on the website,
Yeah.
and it uses Airtable.
Yeah.
So I'm still getting used to Airtable. So I think it'd be more easy for folks to get to. Like I'm new to the committee as well, to the community board, so I'm still learning everything, and so.
Sure, thank you, I appreciate that. Happy to follow up with that. Appreciate that. Yes, Jen.
I think so. There were a few speakers on LGBT youth health that I was planning to invite. So I'd love to do that. And still want to do that. And also, I think like planning some sort of like events in the community, because I think that's another way we can interact in something that's not already there.
Yeah. So I like to be very transparent. So I told you what I do for a living and all of that, and so I consider myself to be a member of the LGBT community. Surprise! But so I'm happy to follow up with you. And you're just talking specifically about youth, or just?
So there's one position I work with who's opening an LGBT clinic specific for LGBT youth who are not able to access services anymore due to Trump, essentially. And in one word, Trump. And I can use other words, but we'll just start there.
Okay.
And then there's another one who spoke at another advocate who spoke at youth education last year about LGBT youth within schools.
So we're partnering with who? The Youth and Education Committee. We obviously we partner with them with this as well. What you said?
Yeah, they've had one of the speakers already.
Okay. But yeah, let's collaborate with them as well. If you feel really putting just like youth in terms of services and in terms of this. Okay. Sounds good. Thanks, Jen. And last but not least, Leslie.
Well, I was assigned to this committee because of my 30 years experience on an ambulance in the city of New York, and what I can bring emergency services to human services to senior services, the knowledge and experience that I've had, emergency room, nurses, clinics, what have you. So that's why I suggested to have the deputy chief of EMS come and speak, statistics, response times, all that information that people just dismiss, and the responses that's going on here. I see that they put in a Third Avenue bike lane, they're putting a Madison Avenue bike lane, they want to put an island on 116, and that's not beneficial for the responses of EMS, because that's the only thoroughfare that goes across town in this community. You can't go across 106, can't go across 110 because they go different ways. But 116 is wide enough for an ambulance and a fire truck to come across town if needed. So these are the things, my knowledge of the streets and the schematics of the streets was highlighted when I was appointed to this committee, that I'll be more beneficial for the information that I can bring forth. That's why.
Well, I value your information, your knowledge. I do. And thank you for your service. You're welcome. So, did we have more? Yes. So, you pointed out, I think you showed me these. Did you want to? So, I saw that on your webpage. We have
right in the webpage. Yes.
So we have this Human Services Organization questionnaire, and we have this request for presentations that still exists, and the so those things still exist, so folks can that's somebody that is interested in what is it?
The organization committee.
Oh,
Right, that's this one.
The purpose is what?
Oh, this, that it should be emailed to.
Okay, thank you. Also, can we
That's what it
update the information, this still has the former chair's name, so so whoever can update the or the form, or it still has thanks for pointing that out.
Can I just say one thing, Mr. Chance? I know I said one talk. You mentioned seeing letters and resolutions. So something I've spoken to Angel about is from now on, when you get your full board agendas, we won't put motions on if there's a letter or a resolution. If it hasn't been actually drafted, and then you'll have a copy in your agenda, we will not vote on it. So we're not going to vote in theory on things or what we haven't seen. The other thing is, we have the supportive housing that had only gone to housing. They were supposed to come here, St. Francis on 3rd Avenue. And so I'm trying to get human services, housing to meet together about that. So there'll be a discussion at the executive meeting this month. So I welcome all members here to attend and participate in that. And then I do have one question, if anybody here knows. We had a moratorium on new substance abuse facilities in the community. And as far as I'm aware, it expired because, I don't know, we were making it every year to renew it, which I'm not sure why that was happening. But with that said, without stating any opinions or anything, has that been discussed? Is that something that was on the table? Because we currently, as far as I'm aware, don't have one. And the board had one, and I don't really remember what the conversation was about why we don't.
We discussed.
Leslie, then.
Go ahead. No, I'm asking. So if you want to.
No, first of all, what is a moratorium? I don't know what that
It
means.
means that we're, sorry.
And then what was it for?
So substance abuse treatment facilities, there was I think the spirit of it was that we had a saturation. And so we were not gonna we were gonna say that we didn't support the siting of new facilities in the community for that.
Yeah.
For that, yeah.
And
Well, I'm just asking, you can tell me what the discussion was, but, I don't know, it just kind of, was there a reason why it was allowed? Like, I don't remember I know you say it was happening, but I can't remember all that, so I'm asking why did it expire, and has there been a conversation, was there a reason?
Just to add to Leslie's question, like we have a high saturation of substance abuse in the city, substantially, like by far. And the community was asking for this, and it came to the community board, and that's how it kind of started from there. Mind you, a lot of these programs are statewide, so we don't always have the option to voice ourselves in. We're more citywide. But it was still such a saturation of mental opportunity to another that it was asked of the community board by the community to have this moratorium.
Put it on 95th Street and 3rd.
So
Just
what
were you gonna say, Jen?
I think Jen had something to say.
Yeah, you did, Jen.
Yeah, so there was a discussion last month about reviewing it. I'm not sure why it expired. We did do an extension of it once, but didn't get to do a second time. But also revisiting some of the language in it as well.
Oh, yeah, I think that it's a living document is what I would call it. So, that's why I was talking about even the expiration. I feel like if we're like, we don't want it anymore, that's one thing. If we feel like it needs to be tweaked, that could be done at, I feel like, any time, right? So I just don't know. I guess if you were talking about it last month, since, like Jose said, the community asked for it, I don't know if we've heard different feedback now, or we could maybe throw that on the surveys and see how people feel about that. Because I think we're here to represent, again, I don't know, whatever people want to see.
Yeah, thanks for bringing that up. So, you don't realize that there's what's the name of our person that comes with the contract with, what's his name again?
Oh, George James.
Yes, I'm sorry. Yeah, so, he comes, he tells us about, things that we need to know about. So he, at one of these meetings, talked about that there's a fair share. You heard of that fair share? So in terms of our communities getting their fair share of facilities, things of that nature, or, harm reduction, things like, so, and Brad Landler actually had a report, so you all should, I'm gonna send this out to you all, because he did talk about that in terms of, you know, is East Harlem oversaturated in terms of things? So look this up, because we need to make sure that this is being, it's being enforced in terms of communities getting their fair share. So please look that up, everybody. I'm happy to send this out. So this came from the Controller's Office, I think it was 2023. But look that up in terms of fair share. So this is not something that we just like some theoretical thing. There's been a study as it relates to, and we may be saturated.
Well, and on that note, housing has asked HPD to hopefully give us an assessment of supportive housing throughout New York City, to let us know how much there is in the 5 boroughs and what our ratio is to that. We keep hearing that we're saturated with it. It's possible that we are. I know that a lot of them are also just built in a very, like Timbali Terrace, Schaefer Hall, Prospero Hall, they're like all right here. So that doesn't necessarily mean it's saturated throughout the community as much as it's concentrated in one area. And I think we should find that out. We keep saying we're saturated, we should know. They should be willing to share that. And then we also have to work towards the stigma of it. I had a call with Timbali Terrace. They were telling us about construction starting with Angel. And they don't have, I walk by there and stuff. I don't see the complaints that a lot of people come with, the scare tactics and all of that. And when it all goes to housing, it's looked at differently. Not because the members there are not compassionate or whatever, it's just a different perspective. So I think that's why, those things need to come here just as much as they go there.
Thank you. And Robert.
I was gonna say, I've probably been in this room longer than any of you for these meetings. And I've been here when the community has come in angry about what they see as a drug circus in their community, and I understand that. But there have been times when I've been afraid for my safety here, I'll be honest with you. And shortly after that, that's when the moratorium began. And I think the purpose of the moratorium was to make sure that an organization like Oasis couldn't just place these organizations wherever they felt, because it seemed like the lion's share was coming here. And since then, I think that this committee has made an effort to understand every organization that comes to us. How many people that you serve are from East Harlem? Yeah. How many people are from other boroughs or New Jersey, et cetera? So I think it's been an enlightenment process. I don't know that the document is it is a living document. It's worthy of being revisited. I know there's a certain sentiment that without it, we're sort of defenseless. I kind of think of it in that sense, like it's as a border protection tactic in that sense. But that's kind of where it's left.
Yeah, so there's a perception, and then, I look at the big E word, equity. So make sure that things are being done in an equitable manner. Yeah, a lot of people say, 1, 2, 3.
Yeah, I'll say, so the moratorium states, so this was 2.5 years ago, so I doubt the numbers changed since then, that East Harlem has 15.4% of the service capacity, but only 4.1% of the needs of the services. There's 2 things. One, I think part of it is we need to differentiate between services that include people that have substance use and then services that are strictly for substance use. Because I think sometimes that has come up and people are like, well, will someone with a substance use disorder be using this service? And it's like, probably, because I use all the services. So. I forgot my other point, but I'll remember it at some point.
Okay. We'll go to Chancellor.
Oh, yeah. Who do we get our data from? Because I would love to see the data. I would love to see what they call saturated, right? What is their definition of saturated? Because if we have 5 in total and they say, we're saturated with things, and it's like, is that 5 really saturated, or is it just you don't want to personally see it and you're just saying this? So I'd love to see the data. I don't know who we'll reach out to for it.
the city has an open data, like, platform.
I hate open data. Open data. I'm
I
sorry.
mean, I can look at the number of trash bins that we have, I
Yeah.
understand that as part of the Act for Environmental Justice.
Yeah.
We don't have as many as south of 96th Street. But, yeah, so I mean, and then particular city agencies as well, right? We can look up,
Yeah, it was Jennifer hit on the nail. I thought the last numbers that I had heard was around 15%. So basically, it's talking about 15% of these kind of services in the entire city. I think in terms of population, we're only 3%. We represent 3%, and about 4% of our population use these services, which means a significant amount of
We're serving other
people, yeah,
people.
servicing a lot of other people, and that's why it's considered oversaturation. Because
So
if they had separated out, we also have an issue with the shelter bus accounts. Which number was it?
M35.
35, yes.
Yeah.
Which has been a long-standing issue,
Lexington?
and so we went to the shelter at night, they bring them out, they put them there, and obviously there's a reason, and then they've asked the city numerous times, but again, they don't know where you shifted to, right? And since a lot of these programs are here, and a lot of people need those programs, this is here.
Yeah.
But if you walk through 125th Street, it is troublesome.
Yes.
I remember that. So I think maybe also doing more beyond the moratorium, because the first time we issued the moratorium, it was like a few months later, they opened the safe injection site. Like, they kind of don't care about the moratorium, and I think we need to make them care about it, besides just being like, here's a piece of paper with how we feel.
It's about on point.
Yeah.
Yeah, I actually know, I people can talk about like, I walked past there, I've actually, I signed up for their volunteer thing, I went inside, and I don't know if you've all done that. I went in there, whatever it's called, orientation, whatever they do. They have a little program, they tell you about their services and all that. I mean, walking there, yes, there's folks that were just, yes, I can see that. But, please, I'm not defending anything, I'm just saying, you should find out for yourself in terms of what they bring to, maybe they have saved, I don't know how many lives they said they've saved, but it's just like, you're walking to and then to the place, and then you see folks just along the sidewalk there, and it's a sad situation, but these are our brothers and sisters and mothers and fathers. But how many lives have they saved with their safe injection sites? So anyway.
Oh, sorry, sorry, just one more thing. And I think part of what you said about stigma is really important, because I lived on 125th in Park for a few years, and I was like, yeah, I just mind my business. And like, I think some people, like, the fear and like all that comes from them like stigmatizing people, and part of it is like, yes, you don't want to see that, but I think stigmatizing it further like makes the situation worse.
So as we about to close, the last thoughts for anybody? I do appreciate everyone, I really do. I do appreciate several, Tanya, I don't know, I've seen you at board meetings, and might have sat next to you, I'm so sorry. Ada, Ada, I remember that. Same thing here, and Jen, I'm sorry, you walked in and I'm sure I've seen, you've been on board for a little bit. Chancellor, I met, very, at the WEAC meeting, I said, Robin, we go way back, and Leslie, she's just a fixture of we all know Leslie. But I do appreciate each and every one, I'm sorry, and the folks online as well. Valerie, I believe, is online, I'm not sure who else is online. But thank you all, I do appreciate everything you said, and it's I listened. I think I'm a very good listener. I do pride myself on my active listening. I'm happy to hear your thoughts, but I do, wish the best for this committee as we move forward. And that is my goal, is just to do my job as the current chair of this committee, and ultimately service the folks of our East Harlem community. So that being said, I think we're closing, and is that correct? Anybody else? Okay, on that note, then Tamika, you have motion to adjourn?
Roll call.
Well, I know, roll call.
I got in trouble for that.
You ready for roll call?
Yes.
Marcel Bandino. Leslie Colon.
Present.
Ada Gabizzi.
Present.
Chancellor Gregg.
Present.
Joe Jones.
Present.
Jennifer Myers.
Present.
Tanya Phelps. Present. Valerie Ponce.
Present.
Oh, I'm present. You hear? Helen, do you hear me? She heard me.
Janelle Satij is absent. And Robin Straser.
Present.
Adela Xavier, attendance will be noted in the minutes.
Any of my food snacks left? Help yourself,
Yes,
folks.
coming back.
No, help yourself.
Thank you for that.
Yeah. Grab the, thank you all again. And I guess, motion to adjourn? Okay, then thanks everybody for coming. We'll see you at the next meeting. Thanks, everyone. And recording has stopped, correct?
I'm gonna do it right now. FDNY?
Yeah.
Oh.
And then.
That's what they do.
He invited all men,